The signal for cardiac contraction is spread of electrical currents through the heart muscle. These currents are produced both by pacemaker cells and specialized conduction tissue within the heart and by the working heart muscle itself. Pacemaker cells are like tiny clocks that repeatedly generate electrical stimuli. The other heart cells, both specialized conduction tissue and working heart muscle, are like cables that transmit these electrical signals. Normally, the signal for heartbeat initiation starts in sinus, also called sinoatrial node. Sinus node is located in right atrium near the opening of superior vena cava and specialized of automatically generating an electrical stimulus. From the sinus node, the stimulus spreads first through the right atrium and then into the left atrium. Electrical stimulation of the right and left atria leads to contraction of atria and pumping blood through the tricuspid and mitral waves into the right and left ventricles. The electrical stimulus when reach the atrio-ventricular junction, also called AV junction. The AV junction connects the atria and ventricles. AV junction is located at the base of interatrial septum and extends into the interventricular septum. The upper part of AV junction is the atrio-ventricular node. Stimulus delay in AV node and allows the time for ventricular filling. The lower part of AV junction is called the bundle of His. The bundle of His when divides into two main branches, the right bundle branch, which distributes the stimulus to the right ventricle, and the left bundle branch, which distributes the stimulus to the left ventricle. The left bundle branch has two major subdivisions called fascicles. There are left anterior and left posterior fascicles. The electrical signal then spreads into the ventricle muscle by way of specialized conduction cells called Purkinje fibers, which are located in subendocardial layer of the ventricles. The electrocardiogram is a special graph that represents the electrical activity of the heart. The ECG is capable of recording only relatively large currents produced by mass of working heart muscle. These currents make ECG waves. Normal ECG starts from P wave. P wave represents atrial depolarization. PQ interval of if the Q wave is absent, PR interval. It is time from start of atrial depolarization to start of ventricular depolarization. PQ or PR segment, it is time from end of atrial depolarization to start of ventricular depolarization. PQ segment represents delay in AV node which allows time for ventricular filling. QRS complex is ventricular depolarization. ST segment, it is time when ventricles are totally depolarized. Normally, it is isoelectric. T wave is ventricular repolarization. J point is junction between end of QRS complex and start of ST segment. It is necessary for detection of ST segment deviation. QT interval is time of ventricular depolarization plus ventricular repolarization.
Here we go.